Cameron, slow down.
So, you enjoy the first aid training?
I did. I just hope I never have to use it.
Me too, but if something happens, I hope you're there to help.
Thanks. So what's the plan for today?
What are you guys looking at?
A crazy video.
Let me see. Let me see. Let me see.
Medical emergencies involving children can happen anywhere at any time. Millions of emergency department visits for pediatric injuries and illnesses occur in the United States every year. Safe practices in childcare settings, home, and play can prevent many pediatric injuries, illnesses, and deaths from occurring. However, once a sudden injury or illness has occurred, effective pediatric first aid can often minimize its severity, improve recovery, or prevent permanent disability or death. Pediatric first aid is the immediate care given to a suddenly ill or injured child until a medical professional or a parent or legal guardian assumes responsibility. It does not take the place of proper medical treatment. Pediatric first aid is intended to preserve life, alleviate suffering, prevent further illness or injury, and promote recovery. Pediatric first aid can be initiated by anyone in any situation. A pediatric first aid provider is trained to recognize and assess the need for first aid, provide appropriate first aid care, recognize limitations, and seek professional medical assistance when necessary. As a trained pediatric first aid provider, you must be able to recognize a medical emergency exists. Often, emergency situations are unexpected events and can be confusing. A general impression is a quick sense of what has occurred or is occurring when you first observe an emergency scene. This impression can provide important clues to help guide you as you continue. Where is the child located? How is the child's body positioned? Does the child appear to be responsive? Does the child look sick or injured? If you suspect an injury, how do you think it happened? Injuries occur due to physical force against the body. The manner in which force creates an injury is called the mechanism of injury. Mechanisms with significant force are best assumed to result in serious injury until proven otherwise. Emergency scenes are often unsafe. Your personal safety is the highest priority, even before the safety of an ill or injured child. Putting yourself in danger to help can make the situation worse. Always pause for a moment before approaching. Look for obvious hazards. Consider the possibility of hidden dangers. If the scene is unsafe, do not approach. If your current location becomes unsafe, get out. One of the most difficult decisions to make is whether or not to get involved when you think a medical emergency has occurred. It is normal to feel hesitant about your ability to help. You might hesitate because you feel like the problem is too big for you to handle alone. You are only the first link in a progressive chain of emergency care. Your involvement lasts only until relieved by another pediatric first aid provider, responding EMS personnel, or a parent or legal guardian. In most cases, a very short period of time. You might hesitate for fear of making things worse. Your training provides you with sound knowledge and skills designed only to help and not harm those in need. You might also hesitate because you think you don't have a lot of medical knowledge. Extensive medical knowledge is not necessary. Pediatric first aid is simple and easy to provide. Finally, you might hesitate because there are others around you who you think might take charge. In fact, others may feel the same way, resulting in no one stepping forward to help. If it is safe to do so, take action. Put what you learn in this program to work. Your actions can help protect or even save a child's life.
sorry. It's important to recognize that there is, when there is an emergency and to act on it. And you're not going to do anything that you're not trained to do that's out of your scope of practice.
It's like kind of like breaking up. I can't really hear what you're saying.
Can you hear me better now?
Oh yeah.
Okay, I moved a little bit more in front of my computer. So it's just important to recognize when an emergency exists and that someone may need your help, and not be hesitant to act on it, because like the video said, you may be the only person who actually steps up and does anything, and you're not gonna, just don't do anything that you're not trained to do. And when someone really needs help, you're not going to really do anything to make it worse per se, because they need help. So it's just important to realize when there is an emergency, and to make sure that the scene is safe before you act on it, because of course you don't want to get hurt yourself. The next thing we're going to go into is just protecting yourself.
When caring for a child, you can be exposed to blood or other potentially infectious body fluids. While the risk of contracting a disease is very low, it's wise to take simple measures to avoid exposure in the first place. Infectious blood-borne diseases include hepatitis B, hepatitis C, and HIV, the virus that causes AIDS. Exposure can occur through the direct contact of infectious material with an open wound or sore, or absorbed through the membranes of the mouth, nose, and eyes. Exposure can also occur through a skin puncture with a contaminated sharp object. Reducing exposure lowers the chance of infection. Standard precautions is a set of protective practices used whether or not an infection is suspected. To be effective, your approach is the same for everyone, regardless of relationship or age. Personal protective equipment, or PPE, describes protective barriers worn to prevent exposure to infectious diseases. Disposable gloves are the most commonly used protective barrier. Make sure they're readily available and always use them. Inspect gloves for damage or tears when you put them on. If damaged, replace them immediately. After providing care, always remove contaminated gloves carefully. Avoiding bare skin, pinch the glove at either palm with the gloved fingers of the opposite hand. Gently pull the glove away from the palm and toward the fingers, turning the glove inside out without snapping. Gather the glove you just removed with your gloved hand. Carefully slide your bare index finger inside the wristband of the gloved hand. Gently pull outwards and down, inverting the glove and trapping the first glove inside. Throw away gloves in an appropriate container to prevent any further contact. Even after using gloves, use soap and water to clean your hands or any exposed skin. Use an alcohol-based hand sanitizer if soap and water aren't available. A CPR mask or shield is recommended when providing rescue breaths during CPR. Another commonly used PPE, a face shield, can be used to prevent mouth, nose, and eye exposure from the possibility of the splashing or spraying bodily fluids, such as in severe bleeding. The use of PPE is expected in your role as a trained pediatric first aid provider at work. Your employer is responsible for making sure appropriate PPE is available. It's recommended to have and use PPE outside of work. Depending on the circumstances and your relationship to a child, you may elect not to use it.
So you guys should always use PPE when necessary if there's any blood or bodily fluids you want to protect yourself. The video shows a pretty good demonstration on how to take off gloves correctly with trying not to contaminate yourself. When you come in to do your hands-on, that's one of your check-off skills, is to be able to take off the gloves the correct way to avoid contamination. I would use PPE no matter what, even if it was a child I knew, like my niece or nephew. If it's my own child, no, I'm not going to use it. But if it's even another family member, I would still use it. You don't know what people have, of course, what infectious diseases they could potentially have just by looking at them, obviously. And even though they're cute and little, you still need to be wearing gloves to protect yourself.
We're gonna get you some more help, okay?
An essential role of the pediatric first aid provider is recognizing when additional help is needed and knowing how to call for it.
Can you activate EMS?
Sure.
Can you let the front office know and bring me back a first aid kit?
Okay. Kids, come with me, okay?
Stay still, okay? I'll get some more help.
Emergency Medical Services, or EMS, describes the pre-hospital emergency medical response system developed within a community. An EMS system uses specialized emergency communication equipment to gather information and dispatch appropriate emergency resources. Trained EMS providers within the system respond directly to emergency scenes, provide advanced medical care, and transport ill or injured people to a hospital. Activating the EMS system usually consists of calling an easy-to-remember number, such as 911. EMS activation is appropriate when there are immediate threats to life, a significant mechanism of injury has occurred, warning signs of serious illness exist, or if you are unsure about the severity of a child's condition. When you make a phone call to activate EMS, a trained dispatcher will guide you through the call. EMS dispatchers are also trained to guide you in the care you provide, especially with CPR. The dispatcher will ask for basic information, such as your location, the type of emergency that has occurred, and what care is being provided. Answer questions as clearly and concisely as you can. Appropriate resources will be notified to respond while you are on the line. The majority of emergency calls in the U.S. are now made on mobile phones. With a mobile phone, you can quickly activate EMS while staying in place next to the affected child. The speaker function of a phone allows you to listen to the dispatcher and provide care at the same time. Young children are much more likely to be involved in a poisoning than an adult. Poison control centers offer free, confidential medical advice 24 hours a day, 7 days a week through the National Poison Helpline at 1-800-222-1222. This service provides a primary resource for poisoning information and care for suspected poisonings. A child care facility should have a written emergency plan for urgent medical problems that provides detailed information on how to respond to and report on emergencies involving children, staff, or volunteers. Your emergency plan should address procedures for things such as managing emergencies for children with special health needs, notification of parents or guardians, accompanying a child at an urgent care facility until a parent or guardian arrives, providing medical personnel with care and consent forms signed by a parent or guardian, managing other children during an emergency, and completing a written incident report. When a medical emergency occurs, procedures should be in place to ensure other children are moved away from the emergency, properly supervised, accounted for, and safe. Emergency action plans should take into account the specific layout, size, and features of a particular location. Child care providers should review the plan when employed and at least annually after. Activating an emergency plan may be as simple as dialing 911. Make sure you understand your emergency plan so you know how to report and respond to emergencies at work. Children with special health care needs are children who require prescription medication, need extra medical, mental health, or educational services, have ongoing emotional, behavioral, or developmental problems, have activity restrictions, or use specialized therapies. Some children have conditions that require daily treatments. The need for prescription medication is by far the most common. However, some children just require attention to signs of impending illness and a timely response. A child with a known medical condition should have both a routine and emergency individual care plan provided by the child's primary medical provider. If a child with a potentially life-threatening special healthcare need is present, a staff member trained in pediatric CPR, first aid, and the administration of any required medication should be available at all times. State child care licensing offices require reporting of injuries. Many states have specific forms that must be used. You should be familiar with the reporting requirements in your state. Most states require that child care facilities maintain first aid supplies in each location where children are cared for, including on field trips and in vehicles. Supplies should be clearly labeled, accessible to staff, and out of reach of children.
Okay. So all the students that I know of that have a medical problem, like I talked about yesterday, they do have a care plan in the office for things that need to be done to protect their health and what to do if there was an emergency. The video talked about the poison control line. I did have to call poison control last year for a student that decided to eat one of those ice packs, like the reusable ice packs out of the freezer in the office.
It like cut off.
Me talking or the video sound?
I can't hear her. Are you able to hear her? I can hear you. I like can't hear anything.
I can hear you, Myra.
Let me hear you. I can't like hear anything. Okay, try to. It's like not the volume's all the way up, but I can't hear anybody. No, I turned it off. Yeah, I turned it on. That was weird. Yeah, because my Bluetooth is off. Yeah, let me. Okay, let me try. It says your internet connection is unstable.
Oh, that was happening to me yesterday. It was like coming in and out.
Anya, can you hear? Okay, Myra's breaking up.
Oh, I'm on mute.
Okay, so try to talk.
Okay.
Okay, now I can. Okay, now it's working.
Okay, wow, I was on mute. That's
Okay, wow, I was on mute, that's why.
Can you guys hear me talk?
Yeah, now I can.
Okay, I know.
I wasn't able to like a couple minutes ago.
Sometimes the internet connection will be poor for a few minutes. That happens in my office all the time. But it looks like my internet connection's fine.
Yeah, because it had such unstable internet, and then I couldn't hear anything that you guys were saying.
Okay. Did you hear the video though? The last part of the video?
Yeah. Yeah,
Okay.
I was able to hear.
Yeah. Okay. So all I was saying was that last year I did have to call the poison control line for a student that decided to get into the freezer in the health office up here and suck and bit a hole through one of those reusable ice packs and suck the contents out. It wound up being non-toxic, so it was fine, but it is a real thing that could happen in the school. So just to warn you.
Yeah.
And all our kids that I know of that have a health problem, like I discussed yesterday, do have a health plan. Do have a health plan that I have written for them. So.
Okay. The last thing I heard was someone. Hold on.
She was saying that someone ate the slushy in the ice pack.
Oh.
Like she was just saying an example that she actually had to call poison control, but it was like non-toxic, and that's what she was just saying this whole time. But just to be aware about the poison control, the number.
All right, I'm going to move on to the next section, the legal considerations. Something that a legal thing is something called implied consent. And all that is saying, like if you were a parent or guardian of a child that needed first aid, even though you're not present at the time to give authorization for that first aid, that it's implied that that parent would want someone to help their child and provide the first aid.
From a legal perspective, medical emergencies involving young children and adolescents are different from those involving adults.
Hey Cameron, it's Miss Lopez. I'm here to help you, okay?
Okay.
I need you to stay very still though.
A pediatric first aid provider must have permission or consent from a parent or legal guardian to give first aid care. In the child care or school setting, consent is typically established ahead of time during the enrollment process by obtaining assigned authorization for emergency medical or dental care. When a child has a life-threatening illness or injury and a parent or guardian isn't present, the legal concept of implied consent assumes a parent or legal guardian would give permission to provide care for their child. Once care is begun, remain with an ill or injured child until someone with equal or greater emergency medical training takes over, or a parent or legal guardian assumes responsibility. If you're alone and unable to use a mobile phone, you may need to leave to activate EMS. Return to the child as soon as you can. Some people fear being sued as a result of incorrectly performing first aid in an emergency. In almost every case, this fear is unwarranted. All states have passed what are known as Good Samaritan laws to encourage bystanders to assist those in need. These laws help protect anyone who voluntarily provides assistance without expecting or accepting compensation, is reasonable and prudent, doesn't provide care beyond the training received, and is not grossly negligent or completely careless in delivering emergency care. Good Samaritan laws vary from state to state. Become familiar with the laws in your state and other states where you work or travel. Regardless of location, simply use common sense and never attempt skills that exceed your training.
Okay, so that section is pretty self-explanatory. You're just going to do what you're trained to do and not provide care that that is out of your scope of training, and you're going to use common sense. Any questions so far over anything we've covered? Okay. Then the next
We're
thing.
gonna go over this tomorrow, right?
What's that, Myra?
I said we're gonna go over this tomorrow.
Yeah, I want to set up a time to meet with each of you tomorrow, probably about 30 minutes each. And we'll practice the hands-on stuff, and then we'll review the care plan for the student that you're going to be working with.
Okay.
So we'll talk about times at the end of the training today, okay? The next thing we're going to get into is emergency moves. Really, if a child has a significant mechanism of injury, like a fall somewhere that was high, or hit their head, or possibly has a neck or head or back injury, we do not want to move them unless it is truly an emergency. So this video is just going to show you some different ways to move a child that can't move themselves during an emergency, like a fire.
It is best not to move a seriously injured child unless he is clearly endangered or requires life-supporting care. The greatest concern is the chance of making existing problems, such as a spinal injury, worse. It may be easy to simply carry a smaller child. If it is necessary to move a larger child you cannot carry, the most effective move to use is a drag. When moving someone, use your legs, not your back, and keep the child as close to your body as possible. When using a drag, pull in the direction of the long axis of the body to keep the spine in line. Never pull on a child's head or pull a child's body sideways. Avoid twisting. Consider the child's weight. Know your physical ability and respect your limitations. Common drags include the extremity drag, performed by grasping and pulling on the ankles or forearms, the clothing drag, performed by pulling on a child's shirt in the neck and shoulder area, and the blanket drag, performed by rolling a child onto a blanket and dragging the blanket. The goal of your training is to help you gain the knowledge, skills, and confidence to effectively manage a medical emergency until more advanced help is available. Pediatric CPR and first aid is easy to learn, remember, and perform.
Okay, so the video showed the 3 different types of drags. I think the blanket drag would be very difficult to do, especially in emergency, taking the time to roll their kid on the side, rolling the blanket under, and then rolling the kid to the other side to bring the blanket through. The easiest ones I feel would be to use the extremity drag, where you're grabbing onto the forearms or the ankle area, or then the clothing drag. And you just want to make sure that the person stays in a straight line, that you're not dragging them sideways to try to keep the spine in line. So the next video we're going to watch is probably one of the most important, going over cardiac arrest, and it is the longest. I want to say it's like 12 minutes long or so. Yeah, it's 12 minutes long. So the body doesn't store oxygen, so it must continue to supply it through the action of respiratory and circulatory system. When oxygen is cut off, it causes cell damage, and cell death can occur, and death can occur within minutes. Cardiac arrest is the loss of the heart's ability to pump blood to the body. Secondary cardiac arrest results in the loss of breathing, such as suffocation or drowning, and this is the most common type of cardiac arrest in children. In adults, primary cardiac arrest is the most common type of cardiac arrest, and that can occur in what's called atrial fibrillation. And at that point, the heart's just not beating effectively. It's kind of like quivering, so it's not pumping blood and oxygen throughout the body effectively. And that's really when it's important to have the AED available, because the AED will shock the heart back into a normal rhythm instead of continuing the ineffective rhythm. Of course, you want to start CPR as soon as possible, and that's a combination of the chest compressions with the rescue breathing. You're going to do 30 compressions to 30 compressions to 2 breaths. And the important thing with providing CPR is that you deliver effective chest compressions. They're hard and fast, and you let the chest recoil. I'm going to show you guys a video on chest compression so you can watch how it's done. And then when you're doing the rescue breaths, you want to make sure that you're watching the chest rise and fall, and you want to make sure that you're not giving too much oxygen or blowing too hard on the person too, especially in an infant, because if you're doing CPR in an infant, their lungs, if you put too much inflation of air in there, it can actually cause what's called a pneumothorax, which will make the lungs, one side of the lungs collapse. CPR skills do change or vary by what age the person is. An infant is considered 1 year of age or younger. A child is 1 year of age or older, and then an adult is considered puberty and above. And really the only time you would start rescue breaths before you start chest compressions would be if you suspected somebody of drowning. Otherwise, you always start with compressions and then move to rescue breaths. So I'm going to play the video.
Because the human body cannot store oxygen, it must continually supply tissues and cells with oxygen through the combined actions of the respiratory and circulatory systems. The respiratory system includes the lungs and the airway, the passage from the mouth and nose to the lungs. Expansion of the chest during breathing causes suction, which pulls outside air containing oxygen through the airway and into the lungs. Relaxation of the chest increases the pressure within and forces used air to be exhaled from the lungs. The circulatory system includes the heart and a body-wide network of blood vessels. Electrical impulses stimulate contractions of the heart to create pressure that pushes blood throughout the body. Blood vessels in the lungs absorb oxygen from inhaled air. The oxygen-rich blood goes to the heart, then out to the rest of the body. Large vessels, called arteries, carry oxygenated blood away from the heart. Arteries branch down into very small vessels that allow oxygen to be absorbed directly into blood cells. Veins return oxygen-poor blood back to the heart and lungs, where the cycle repeats. The brain is especially sensitive to a lack of oxygen. When oxygen is cut off, cell damage and death can occur within a matter of minutes. Cardiac arrest in children is usually the end result of the loss of breathing. This is known as secondary cardiac arrest. Causes of secondary cardiac arrest include hazardous breathing conditions, sudden infant death syndrome or SIDS, suffocation, entrapment, drowning, choking, and drug overdoses.
Sentence. Wake up, buddy. Call 911.
Okay.
With no incoming oxygen, the heart progressively becomes weaker until signs of life become difficult or impossible to assess. Cardiopulmonary resuscitation, or CPR, is the immediate treatment for cardiac arrest. CPR restores limited oxygen to the brain through a combination of chest compressions and rescue breaths. If a child's heart is too weak to create obvious signs of life, immediate CPR with an emphasis on effective rescue breaths may be the only chance to restore them. CPR skills vary a bit depending on age. When describing age groups in relation to CPR, an infant is younger than 1 year of age. A child is 1 year of age until the onset of puberty. Puberty can be estimated by breast development in females and the presence of armpit hair in males. An adult is from the onset of puberty and older. The pediatric chain of survival is often used to describe the best approach for treating a child in cardiac arrest. Each link in the chain is essential for a child to survive. If a single link is weak or missing, the chances for survival are greatly reduced. The greatest chance exists when all the links are strong. Prevention of the typical causes for airway and breathing emergencies. Early CPR with an emphasis on effective rescue breaths. Prompt activation of EMS to quickly get professional care. Effective basic and advanced EMS care and transport. And effective post-cardiac arrest care in a hospital. The abuse of opioid drugs is a serious and growing health problem. Increasing prescriptions for opioid pain relievers, such as hydrocodone and oxycodone, have made them more commonly available. The use of heroin, a highly addictive opioid, is also contributing to the problem. As a result, overdoses and deaths from prescription opioids and heroin have risen dramatically among both adults and adolescents. With wider availability, the chance of an accidental overdose of a young child has also increased. Opioids taken in excess can depress and stop breathing. Opioid overdose is a clear cause of secondary cardiac arrest. Naloxone, also known as Narcan, is a medication that can temporarily reverse the life-threatening effects of opioids. Naloxone is becoming more readily available to those without formal medical training. Different than secondary cardiac arrest, sudden cardiac arrest primarily affects adults. It can happen with little or no warning. Victims abruptly become unresponsive and collapse. Abnormal gasping can occur. Breathing stops. The most likely cause of sudden cardiac arrest is an unexpected disruption to the heart's electrical system, in which normally organized electrical pulses become disorganized and a chaotic quivering condition known as ventricular fibrillation occurs. Blood flow, along with the oxygen it carries, stops. Without blood flow, brain damage occurs rapidly and quickly leads to death. CPR is the immediate treatment for sudden cardiac arrest. However, CPR alone is not enough. The most effective way to end fibrillation is defibrillation, using a defibrillator and electrode pads applied to the chest. A controlled electrical shock is sent through the heart to stop ventricular fibrillation, allowing the heart's normal electrical activity to return and restore blood flow. Successful defibrillation is highly dependent on how quickly defibrillation occurs. For each minute in sudden cardiac arrest, the chance of surviving goes down by 10%. After as few as 10 minutes, survival is unlikely. Simply activating EMS will not help. Even in the best EMS systems, the amount of time it takes from recognition of the arrest to EMS arriving at the site of the victim is usually longer than 10 minutes. An automated external defibrillator, or AED, is a portable, computerized device that is simple for anyone to operate. Bystander use of AEDs has been growing steadily, with common placements of the devices in public locations such as airports, hotels, and workplaces. Turning on an AED is as simple as pushing a power button. Once on, an AED provides voice instructions to guide an operator through its use.
Remove clothes from patient's chest.
An AED automatically analyzes the heart rhythm to determine if a shock is needed.
Analyzing heart rhythm. Shock advised. Stay clear.
If a shock is advised by the AED, the operator clears the person and pushes a button to deliver the shock. The adult chain of survival is often used to describe the best approach for treating sudden cardiac arrest. Early recognition of cardiac arrest and activation of EMS. Immediate CPR with high-quality chest compressions. Rapid defibrillation of the heart. Effective basic and advanced EMS care and transport, and effective post-cardiac arrest care at a hospital. Although rare, children can experience sudden cardiac arrest with ventricular fibrillation due to existing heart problems or an accident, such as a blow to the chest or an electrocution.
He's unresponsive and not breathing. Contact
Okay.
EMS.
When available, include the use of an AED when cardiac arrest of a child or infant occurs.
Okay, so the next thing we're going to get into is chest compressions, and that's the way you do the chest compressions is going to vary according to the person's age Like we discussed, infant is below 1 year, child is 1 year and above, and then adult is from the onset of puberty and beyond. So with an infant, you still do the same amount of chest compressions for everybody and rescue breaths, 30 to 2, but with an infant, you use 2 fingers. With an adult, you use 2 hands, which you'll see. And then with a child, it's usually 1 hand. But if you get too fatigued from doing CPR for a long time and the chest compressions aren't effective anymore, you can use 2 hands for the child as well. And then the depth that you compress is just a little bit different for the infant. You only go like 1.5 versus 2 inches for the depth of the compressions. So I'm going to show the videos for the chest compression. I did a training last week, and the people I trained wanted to watch the videos for all age groups. So I'll go ahead and do that this time. So we'll do the one with all ages.
There are basic CPR skills used to provide the most effective approach to cardiac arrest: chest compressions, rescue breaths, use of an automated external defibrillator, and checking for life-threatening emergencies using a primary assessment. External compression of the chest increases pressure inside the chest and directly compresses the heart, forcing blood to move from the chest to the lungs, brain, and rest of the body. To perform high-quality compressions on a child, position the child on his or her back on a flat, firm surface. Kneel close to the chest and place the heel of one hand on the lower half of the breastbone, just above the point where the ribs meet. Bring your body up and over the chest so your shoulder is directly above your hand. Straighten your arm and lock your elbow. Using upper body weight, push straight down at least 1/3 the depth of the chest, or about 2 inches. Lift your hand and allow the chest to fully return to its normal position. Without pausing, continue into the downstroke of the next compression. Continue compressing at a rate between 100 and 120 times per minute. Quality matters. The better you compress, the greater the influence on survival. Focus on high-quality techniques. Compress deeply, at least 1/3 the depth of the chest, or about 2 inches. Compress fast, between 100 and 120 times a minute. Get close and do not lean on the chest. Allow the chest wall to fully recoil or rebound at the top of each compression. Blood pressure is created and maintained with ongoing compressions. When compressions stop, pressure is quickly lost and has to be built up again. Avoid interruptions to maintain high-quality CPR. Compressions can be tiring. If you need to, use 2 hands to perform compressions on a child. The two-handed compression technique is also used for adults. Kneel close to the chest. Place the heel of one hand on the center of the chest on the lower half of the breastbone. Place the heel of your other hand on top of and parallel to the first. Bring your body up and over the chest so your shoulders are directly above your hands. Straighten your arms and lock your elbows. Bending at the waist, use your upper body weight to compress to a depth of at least 2 inches. Lift your hands and allow the chest to fully return to its normal position. Without pausing, continue into the downstroke of the next compression. Continue compressing at a rate between 100 and 120 times per minute. CPR feedback devices measure things such as depth, rate, and timing, and are available to improve adult compression quality during practice. When compressing properly on an adult, you may hear and feel changes in the chest wall. This is normal. Forceful external chest compressions may cause chest injury, but are critical if the person is to survive. Reassess your hand positioning and continue compressions. To perform chest compressions on an infant, position the infant face up on a flat, firm surface. Place 2 fingertips on the breastbone just below the nipple line. Compress at least 1/3 the full depth of the infant's chest, or about 1 1/2 inches. Lift your fingers and allow the chest to fully return to its normal position. Without pausing, continue into the downstroke of the next compression. Continue compressing at a rate between 100 and 120 times per minute. Allow the chest to fully rebound at the top of each compression.
Okay, so you guys saw how chest compressions are given for all ages. The important thing is that quality of the chest compression really matters. You want to compress deeply, compress fast, and you want to allow that chest to fully recoil in between compressions. But at the same time, you're not totally taking your hand off of the chest. You're just letting the chest come back up and rise before you go into your next compression. You want to kneel close. That way you have a better angle to give effective chest compressions, and you're going to compress at a rate of 100 and 120 times per minute. We don't want to lean on the chest in between compressions. CPR can be very tiring, so if you need to use 2 hands on a child to maintain the quality of the CPR, that's fine. Like I said, for adults and children, you're going to compress at least 2 inches. For infants, about 1.5 inches. You guys have any questions on what you just saw for the chest compressions? Do you want me to show the video guided practice for each age group?
Sure.
Okay, we'll watch child first.
In this practice, you will perform chest compressions by following along with the video demonstration. Each person should have a mannequin. You will do 2 sets of 30 compressions. If you need more practice when it ends, run the segment again. Are you ready? The demonstration will start in 5, 4, 3, 2, 1.
So you see in the video, they're not showing the rescue breaths because it's just concentrating on showing the skills of compression. But after the 30 compressions, that's when you would give the 2 rescue breaths. Any questions for that at all? And usually if I could hold a traditional class, I would have everybody in like groups of 2, at least 2 to 3, and you would share a mannequin and practice that. But since I can't do that right now because of COVID, you guys will come in and I will demonstrate how to do it, and then you will demonstrate after I do. So we'll watch the adult.
In this practice, you will perform chest compressions by following along with the video demonstration. Each person should have a mannequin. You will do 2 sets of 30 compressions. If you need more practice when it ends, run the segment again. Are you ready? The demonstration will start in 5, 4, 3, 2, 1.
Is yours freeze?
Mm-mm.
Mine's frozen.
Myra, do you need me to replay that one? I heard you say that it froze.
Yeah, please.
Okay, I'll replay it.
In this practice, you will perform chest compressions by following along with the video demonstration. Each person should have a mannequin. You will do 2 sets of 30 compressions. If you need more practice when it ends, run the segment again. Are you ready? The demonstration will start in 5, 4, 3, 2, 1. In this practice, you will perform chest compressions by following along with the video demonstration. Each person should have a mannequin. You will do 2 sets of 30 compressions. If you need more practice when it ends, run the segment again. Are you ready? The demonstration will start in 5, 4, 3, 2, 1.
Okay, so we're going to cover rescue breaths and then use of the AED, and then I'll give you guys a few minute break, and then we'll come back and finish up the rest of the information. We already talked a little bit about rescue breaths. When giving a rescue breath, we want to make sure that we're providing a good airway to give those rescue breaths. Otherwise, the air is not going to get down into their lungs. And by doing that, we use the head tilt chin lift, because a person that's laying on their block or on their back, their tongue can block their airway. So we want to make sure that we get their airway open. And the airway is always a higher priority than a suspected spinal injury, because obviously if they're not breathing, it doesn't really matter what's going on with their spine. At that point, their airway and their breathing is the #1 priority. There are different barrier devices that you can use, which is the face mask. And then there's also like a little face shield. It looks like a clear, kind of like a Ziploc baggie, but it has a little like mesh part that goes over the person's mouth. Because during CPR, a lot of times people will have stuff coming out of their mouth, or they will have vomit as well. So you want to protect yourself and use a barrier device. Each rescue breath should be given over 1 second in length and should have enough air, giving enough air to see that chest visibly rise, but we don't want to give extra air. During CPR, 2 rescue breaths are given at a time, and we're going to provide them as quickly as possible in less than 10 seconds. but you should get a breath for yourself in between the 2 breaths that you're giving the person that you're providing the rescue breaths to. Special care should be taken not to provide too much air, especially to children and infants. And rescue breaths are performed the same for all age groups. So I'll show this.
Rescue breaths are artificial breaths given to someone who is not breathing. The air you breathe contains about 21% oxygen. Your exhaled air still contains about 16 and 17% oxygen. This exhaled oxygen is enough to support someone's life. To give rescue breaths, you need to make sure there's an open airway. The airway is the only path for getting air into the lungs. Someone who is unresponsive can lose muscle tone. If flat on his or her back, the base of the tongue can relax and obstruct the airway. This is the most common cause of a blocked airway. The tongue is attached to the lower jaw. Lifting the jaw forward while keeping the mouth open pulls the tongue away from the back of the throat and opens the airway. You can open a child's airway by using the head tilt chin lift technique. Place one hand on the forehead. Place the fingertips of your other hand under the bony part of the chin. Apply firm backward pressure on the forehead while lifting the chin upward. This will tilt the head back and move the jaw forward. Avoid pressing into the soft tissue of the chin with your fingers, as this can also obstruct the airway. Leave the mouth slightly open. Even though the risk is very low, use a protective barrier such as a CPR mask when giving rescue breaths to minimize your exposure to infectious disease. Use a mask appropriate for the size of the child. Quickly inspect it to make sure the one-way valve is in place. Place the mask flat on the child's face. Use your thumb and forefinger to provide uniform pressure around the top of the mask. Use the thumb of your hand lifting the chin to control the bottom. Tilt the head and lift the chin to open the airway. Lift the face up into the mask to create an airtight seal. Blow through the valve opening to deliver breaths. Each breath should be about 1 second in length and have only enough air to create a visible rise of the chest, but no more. Additional air is unnecessary. During CPR, 2 rescue breaths are given at a time. Remove your mouth between breaths. Take a breath before delivering the second rescue breath. When you remove your hands from the head, the airway will close again. It's necessary to open the airway each time you give rescue breaths. If you can't get the chest to rise with a breath, reposition the head further back by using head tilt chin lift again, and try another breath. To give rescue breaths using an overlay shield, place the breathing port of the shield between the teeth and into the child's mouth. Tilt the head and lift the chin to open the airway. Seal the nose by pinching the nostrils closed. Take a normal breath. Open your mouth wide and press your mouth onto the shield around the child's mouth to create an airtight seal. Blow through the port to deliver the breath. Each breath should be about 1 second in length and have only enough air to create a visible rise of the chest, but no more. Remove your mouth after each breath. Take a breath before delivering another rescue breath. The same technique can be used to provide mouth-to-mouth rescue breaths if you elect not to use a barrier device. Rescue breaths for adults are performed in the same manner as for children. Each breath should be about 1 second in length and have only enough air to create a visible rise of the chest, but no more. Rescue breaths for infants are also performed the same as for children. Use an appropriately sized CPR mask when performing rescue breaths on an infant. Special care must be taken to not give too much air in a single breath. Provide only enough air to make the chest visibly rise, but no more.
Okay, so there are different sizes of face masks to use, whether it's an infant, a child, or adult. And it's important to select the correct size, because if you select one that's too big, obviously there's not going to be a good seal around the mouth, and then air will escape. And if there's one too small, it's not going to be in the proper area over the mouth and the nose to give the breath effectively. So I'll show the videos, again, the guided practice videos for each age group.
In this practice, you will perform rescue breaths by following along with the video demonstration. Each person should have a mannequin and a CPR mask with a personal one-way valve or mouthpiece. You will do 5 sets of 2 rescue breaths, taking about 4 seconds between each set. If you need more practice when it ends, run this segment again. Are you ready? The demonstration will start in 5, 4, 3, 2, 1.
Breathe, breathe. Breathe, breathe. Breathe, breathe. Breathe, breathe. Breathe, breathe.
In this practice, you will perform rescue breaths by following along with the video demonstration. Each person should have a mannequin and a CPR mask with a personal one-way valve or mouthpiece. You will do 5 sets of 2 rescue breaths, taking about 4 seconds between each set. If you need more practice when it ends, run this segment again. Are you ready? The demonstration will start in 5, 4, 3, 2, 1.
Breathe, breathe. Breathe, breathe. Breathe, breathe. Breathe, breathe. Breathe, breathe.
In this practice, you will perform rescue breaths by following along with the video demonstration. Each person should have a mannequin and a CPR mask with a personal one-way valve or mouthpiece. You will do 5 sets of 2 rescue breaths, taking about 4 seconds between each set. If you need more practice when it ends, run this segment again. Are you ready? The demonstration will start in 5, 4, 3, 2, 1.
Breathe, breathe. Breathe, breathe. Breathe, breathe. Breathe, breathe. Breathe, breathe.
Any questions with the rescue breaths?
No.
Okay. We'll move on to use of the AEDs, the automatic external defibrillators. We currently do not have any at our school district. I've been working on trying to get them for the school district. That was one of my goals, is to be able to get them for the kids and the employees here. With AEDs, they will come with, we'll order pediatric pads and adult size pads. I won't need the infant pads, but just to be aware, there are different sizes of pads for the individual versus their, their body. AEDs should not be used, of course, in water. If the person is wet, there should be dried off appropriately first. If the person has a real hairy chest or something, the shock won't be delivered effectively. So what I would suggest doing if you had to use it is applying a set of pads on, using those pads to rip the hair off, and then put a new set of pads on that are not hairy, so they stick to the chest wall good to be able to provide a shock. And they're really easy to use. They tell you exactly what to do. Can you guys hear?
Yeah.
Okay. They're really easy to use. They tell you exactly what to do. The idea is hopefully, if you did need to use one, that it's easily accessible, and maybe someone could start CPR while another person goes and gets the AED and is calling 911. But as soon as the AED arrives at the person's location, you want to go ahead and turn it on and start setting it up to use, because it's going to tell you what to do next. Sometimes children and infants will need an AED. There may be circumstances where they'll have to be used, and the steps are the same, whether it's an infant, an adult, or a child, or an infant, an adult, or a child. It's just a different type of the size pads that you would use. They will guide you through actions, and will tell you if a shock is indicated or if not. And then you don't want to take off the pads on the AED or shut it off while you're doing CPR, while you're in the process. It will tell you when to deliver the shock and you stand clear, but you don't want to remove it because a second shock may be necessary, and then you'll have to go through the whole steps again. So you want to leave that AED attached the whole time that you're providing resuscitation to the person.
AEDs are designed to be simple to use. Voice, lights, and screen instructions guide a user in operating the device.
Remove clothes from patient's chest.
There are many different brands of AEDs, but the same basic steps for operation apply to all. Opening the lid will turn on the power for some AEDs. With others, simply press the power button. This starts voice instructions and readies the device for use.
Remove clothes from patient's chest.
Pads must be applied to a bare chest. Quickly tear away or use scissors to remove all clothing from the torso. For a woman, remove the bra to provide better access for pad placement. Locate and pull out the defibrillation pads. The pads have pictures on them to show proper placement. Peel the pads from the backing sheet one at a time and place them as shown in the pictures. For an adult, place one pad below the right collarbone above the nipple and beside the breastbone. Make sure it adheres well by pressing it flat. Place the other pad lower on the left side over the ribs and a few inches below the armpit. Again, press firmly. Most AEDs automatically start analyzing once the pads are in place.
Analyzing heart rhythm.
Movement can interrupt the analysis. Be certain no one is touching the person. If defibrillation is advised, the AED will begin to charge for shock delivery. Quickly look to make sure no one, including you, is in contact with the person before delivering the shock.
Shock delivered.
For most AEDs, a button is pressed to deliver the shock. Once delivered, immediately resume CPR, starting with chest compressions.
Nick! Nick! Nick, are you okay? You okay? Charlie, do you have your cell phone?
Yes.
Can you call EMS?
Okay.
Chris, can you get the AED and the first aid kit?
Yeah. You guys come over here with me, please?
Nick, are you okay?
We have a child down, sir. I was hitting the chest with a crossbow.
Conditions can occur for which defibrillation of a child or infant is warranted. Most AEDs have specially designed pads or mechanisms available that reduce the defibrillation energy to a level more appropriate for a smaller body size.
Remove clothes from patient's chest.
He's not breathing.
The steps for using an AED on a child or infant are the same as for an adult. For smaller chests, place one pad on the center of the chest just below the collarbones. Attach the second pad on the center of the back between the shoulder blades. Follow the AED's voice instructions to provide the appropriate care.
Analyzing heart rhythm. Analyzing heart rhythm. Shock advised. Stay clear of patient. Press the flashing orange button now.
He's moving, Chris, he's moving. Nick, you okay? Relax.
You all right, bud?
Let's roll him over on the side.
We got you here. All right.
If an AED specifically equipped for use on a child or infant is not available, an AED configured for an adult can be used instead. AEDs are also designed to detect problems during use and guide you through corrective actions.
Replace battery immediately.
If a troubleshooting message occurs at any time, stay calm and follow the AED's voice instructions.
Okay, I'm gonna give you guys a 5-minute break. We'll come back at about 10:35, okay, and we'll finish up.
Okay.